Human papillomavirus is the most common sexually transmitted infection. It is a group of more than 200 related viruses. Transmission occurs primarily through intimate skin-to-skin contact, most commonly during unprotected sexual contact. Symptoms and health problems vary. Often, HPV is asymptomatic, and the immune system usually clears the virus within 1 to 2 years. When symptoms do occur, they can include genital warts, which appear as small bumps, or groups of bumps in the genital area. Certain HPV infections can lead to cancer, which may take years or decades to develop after the initial infection. Cervical cancer is the most common cancer associated with HPV. There are two main classifications of HPV types: low risk or non-oncogenic types, such as HPV 6 and 11, cause genital warts and recurrent respiratory papillomatosis. High risk or oncogenic types, such as HPV 16 and 18, cause cancer. These high-risk types are responsible for nearly all cervical cancers, as well as other genital cancers and oropharynx cancers, which is the back of the throat. Diagnosis primarily focuses on cervical cancer screening for women. The HPV test is the preferred primary screening method for women aged 25 and older, as it detects the presence of high-risk HPV DNA. The pap smear looks for abnormal cervical cells. Co-testing involves both an HPV test and a pap smear together, typically recommended for women aged 30 and older. There is no routine Food and Drug Administration approved test for HPV in men. Diagnosis of genital warts or related cancers in men is based on clinical appearance and biopsy. There is no treatment for the HPV virus itself. The goal of treatment is to manage the health problems it causes. Genital warts can be treated with topical medications like imiquimod or podophylax, cryotherapy, or surgical removal. Precancerous cervical lesions are treated with procedures like the LEEP electrosurgical excision procedure or cryotherapy. HPV-related cancers are treated with standard cancer therapies, including surgery, radiation, and chemotherapy. Prevention is the most important strategy. Vaccination is the most effective prevention method. Gardasil 9 protects against 9 HPV types, including 7 high-risk and 2 low-risk types. The vaccination schedule recommends it for all adolescents, both boys and girls, at age 11 or 12, and it can be started as early as age 9. Catch-up vaccination is recommended for everyone through age 26. Adults aged 27 to 45 should discuss vaccination with their doctor. Regular cervical cancer screening for women is crucial. Safe sex practices, such as using condoms, can reduce but not eliminate the risk of transmission. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.